Now, this is a very interesting atrocity of the chest, which can tell us about so many things. Now, when we zoom into the films, what we can see is we can see this lung fields. We can see this lung field, and there are problems at two areas. There is something in this hilar area, that too on both the side, and there is problem in this area. So basically, there are two problems. First thing is this is heart, and just at the hilum in the center, we are having some problem here in both the side. So this is very typical of perihilar area, from where this trachea divides. You can very nicely see this is the division of the trachea, and these are the two main bronchi that are emerging. So bronchovascular bundles goes through here only, bronchi grows through here only, pulmonary artery and its vasculature also goes through here only, and pulmonary veins also is present in this area only. So this means this is a typical perihilar involvement, and there is some problem here. We can very nicely make out. So whenever there is perihilar involvement, there is highly likely uh, two problems are there. First is pulmonary edema, where there will be perihilar involvement bilaterally. And perihilar involvement in pulmonary edema is a feature of LVF. LVF means left ventricular failure, because as we know, heart uh, heart will pump to lungs, and lungs will again give oxygenation, and it will come to the left side of the heart, and then heart will pump this to rest of the body. So this is the way. But whenever there is left ventricular failure, so the heart will not pump. So whatever blood is coming from lungs, it will remain, or it will be kept into the heart. So automatically there will be a pressure difference. So heart will not pump ahead. So there will be congestion in the pulmonary vasculature, and that is what is pulmonary edema. So there will be congestion of this fluid, and this fluid can be very crystal clearly seen in the perihilar region. So this can be either pulmonary edema, or second thing, it can be PCP, that is pneumocystis carinii infection. So we must know pneumocystis carinii is seen in immunocompromised patients, especially those patients who are uncontrolled diabetic, cancer patients, or very commonly HIV patients. So we must know PCP is an infection. So what we see is fluffy shadows. We see cotton wool like fluffy shadows in perihilar region, as well as in the periphery also. So when we see and in if there is PCP, the chances of pleural effusion will be much lesser, because it is more of an infection. But if it is LVF, if it is pulmonary edema, if it is LVF, then the chances of the pleural effusion, bilateral pleural effusion, will be very high. So if it is LVF, because we know bilateral pleural effusion or left-sided or right-sided pleural effusion is one of the hallmark of, it is one of the criteria for LVF. So pulmonary edema suggests left ventricular failure, and pleural effusion also suggests left ventricular failure. Now, when we see that this is the margin of the rib, so in here we have lung. So we can very crystal clearly see that this area is all lung, because we can see the black air, that is radiolucent, is all air. But here what we can see is this component. Now, this is what is either fluid or consolidation. So, it can be only two things, either it will be a fluid or it will be a consolidation. Now, the features of fluid is fluid will settle down to whatever area it is present in. So, if it is rectangular shaped, fluid will have a rectangular shape or a flat surface. If it is concave, fluid will also take the concave shape. Whereas in consolidation, it will not take the shape of the rib, or it will not take the shape of concavity. So When we see this area, you can focus in here that it has taken up the shape. It is crescent shaped or moon shaped. So this crescent shape, that is the tips in the midline or tips around the rib border, is very typically seen in pleural effusion. So these are the tips and the middle part is all fluid. So this is very highly likely that this is fluid only and not consolidation. One more thing that you may we may still remember is whenever there is a consolidation or pneumonia, it will be almost always like patchy. You can see in here that it is almost always patchy, because we know that this lung is all made up of small multiple alveoli. So, and what is pneumonia is, it is accumulation of this proteinaceous fluid, proteinaceous material into the alveoli. So obviously we will see pneumonia as this type of structure. There will be multiple small pockets like structure, and which will be in a mixed pattern, definitely. So there will not be any gaps in between. Uh, so here, when we see this, may look like consolidation. This is actually perihilar lesion, but I'm simply, if you want to understand the difference between pleural effusion and patch, this this is almost of same homogeneity. This has same homogeneity. This, if you see this lesion or this structure, this has almost a uniform radiolucency, radiodensity. It is not having any patches in between like this. So this is like a kind of patch, but here you will not see any patch. This is all homogeneous and of only one single color, means radiolucency or radio density. So that is the reason this is taking the shape of chest. This has organized around the lung borders. It means ki it is in the pleural space. It has crescent shaped uh, structure. It is moon-like structure. It has the expansion, or it is going around the lung borders. So this is pleural effusion and this is not consolidation. So in short, this patient has bihilar involvement and presence of bilateral pleural effusion. This goes highly in favor of acute LVF. So this is a very, very typical example of LVF with pulmonary edema because of presence of bihilar involvement, which typically suggests pulmonary edema with bilateral pleural effusion, which is very highly suggestive of LVF. So in short, this is a case of acute LVF with pulmonary edema with bilateral pleural effusion. Thank you.